Today we are at the Coastal Virginia Surgery Center, and we are going to see what it is like from the time you check in to the time you leave. So if you have anything that you might need a procedure on, today we're going to provide you with all of that information. Let's go check it out. Hello.
Good morning.
How are you doing today?
Good. How about yourself?
Yes. So Christine, I know that we are here at the Coastal Virginia Surgery Center, and if I was per se getting checked in for something like a shoulder surgery, what's the process like?
The day of the surgery, we have you show up here with a family member or a loved one.
Okay.
They will have you registered, and then you'll have a seat behind you. And while you're in surgery, your loved one will get a text message saying that you've arrived. You'll get one when they go to the OR. You'll get one when you come out of the OR, and then they actually will speak to the doctor in person.
Awesome. Thank you so much. Can't wait to see the rest.
Thank you.
All right, so right now we are in the pre-op.
Correct.
And what can somebody expect when they come in? If somebody's feeling anxious or uncomfortable, what things do you do to make them feel more comfortable?
Well, we're gonna definitely get a set of vital signs on you and get you set up on the stretcher. Get you a nice warm blanket. The doctor will speak with you as well as the anesthesiologist before you receive any medication.
Okay. And then after this is done, that's when we get to go.
That's correct. You will roll to the OR.
Okay, we have finally made it past pre-op, and now we are officially in the OR with Erick. What protocols do you have to keep everybody safe, to keep your team moving in unison? How does that flow?
It just goes with a lot of checks. So one is your airway. That's number one. Once we determine you're safe from that standpoint, we move into the positioning. After that, we do a timeout, which we go over the procedure that you're gonna have, your name, your allergies, the antibiotics you've been given.
So I know that it's very important that you keep everybody safe. In particular today, we've been talking a lot about a shoulder surgery, but what other things do you guys offer here?
They range from big surgeries such as spine and total joints to small surgeries. We do a lot of scope surgeries, and that's this equipment right here, along with even smaller surgeries such as cyst removals and carpal tunnels and stuff like that.
Well, I know that you just mentioned the equipment. Is there anything that sets the equipment that you have here apart from other people who offer similar services?
Yeah, first and foremost is our surgeons. They're board certified and fellowship trained. That makes a huge difference. Our equipment, we have state-of-the-art stuff on site, such as our Hannah table, our Jackson tables. Our surgeons are always looking to be on the forefront and looking for the best for their patients.
So it seems like you have some of the best surgeons, some of the best equipment. So that's absolutely amazing. And when a procedure is done or anything like that, just to ask, because maybe I'm a little hungry, but how do you wake somebody up? Do they get a snack, anything like that? What's the good stuff?
As long as you're meeting protocols, we will definitely give you some cookies eventually. We have to make sure that everything is going good from your vitals and everything on that end.
And your safety first.
Yeah, safety first. That's always paramount.
All right. Well, thank you so much, Erick. I would like a cookie, but thank you.
Thank you so much.
All right, I finally made it out of the operating room, and right now I'm in recovery. I have with me Shannon from the Orthopaedic Spine Center. And could you just please tell me a little bit about this recovery room and what happens here?
Yeah, well, I am playing the role of your friend or family member right now, because it's very important that you have someone with you when you're being discharged, because typically, you're not in the best state of mind having just come out of anesthesia to sign papers or to listen to discharge instructions. And as promised, we have a special treat for you. Some crackers and some ginger ale, because I know you were looking forward to that.
I was, yes. It has been an amazing experience being able to walk through everything, to experience it physically, having to see what it's like to be wheeled back. Everything was so polished and nice. The rooms were so clean. The staff was so great as far as making sure that I stayed warm.
Thank
and
you.
Then here you come with what I wanted, a treat. So I was very happy with that.
Great.
If somebody's interested in the services that you offer here, where can they find you?
Absolutely. You can go online and find us at thecvsc.com. That stands for Coastal Virginia Surgery Center.
Yes.
Thank you so much for coming.
Thank you so much. I'm going to go ahead and finish my recovery and have my crackers and my drink.
Fantastic.
Thank you.
Thanks.